Hello, and welcome to a swift view on health. My name is Scott Shainvogel, and today I want to talk to you about a new Indiana policy around hospitals' tax exempt status. So, this wasn't a major focus in the news this past week, but I believe this may be one of the most important precedents around hospitals and healthcare systems tax exempt status that we've seen in quite some time. And I think that it creates an opportunity for us to talk about the role that hospitals and healthcare systems can play in really transforming our healthcare future. So let's get into the details a little bit, share with you a little bit about what happened and why I think this is so important. So, just as background, it's important to know that tax exempt status for healthcare systems creates a tremendous amount of value for those healthcare systems all across the country. So, over $37 billion of tax benefits currently accrue to healthcare systems today. And the primary return for those tax benefits, it generally is charity care, meaning that a hospital, particularly under EMTALA laws, if someone needs care, hospitals have to provide it. And if they cannot afford that care, have some type of financial assistance or charity care that they can provide. But as you see here, the tax benefits versus the charity care, there's a fairly significant difference there. And almost $20 billion, or over $20 billion. And if you actually look at charity care for profit versus not for profit healthcare systems, it appears that not for profits offer even less charity care than for profit healthcare systems. So, about $2.30 per every $100 of expense in a healthcare system is assigned to financial assistance or charity care. So, about a little over 2% of all of our cost in a healthcare system is currently going to charity care today. And I think the question with healthcare costs increasing so much, is that enough? Are hospitals and healthcare systems generally creating enough community impact and benefit in return for the tax benefit status that they're creating? In the case of Indiana, that answer was no. Indiana felt like healthcare costs, particularly for employers, and the amount of money that they were spending on their employees was primarily driven by large healthcare systems, which tend to dominate the Indiana marketplace. And most marketplaces across the country are semi-monopolistic for healthcare systems, and that those costs were just too high and non-sustainable. The government, the governor and the legislature of Indiana went ahead and wrote a law that just required the 5 largest nonprofit health systems to basically adjust all of their commercial insurance rates, so effectively the rates they've negotiated with insurance companies, to be at or below a state benchmark by 2029. And this is their response, basically to manage, this effective utility or monopoly. The legislature and the governor had believed had been created in the state of Indiana to bring those costs back in line. And if those hospital systems did not do that, then they would lose their tax exempt status. And once again, having to then pay, those hundreds of millions, if not billions of dollars of taxes. I'm not necessarily want to advocate today that the answer is for states to go out and legislate price controls for healthcare systems. I do think that the benefits that accrue to healthcare systems from their tax exempt status does lend itself to a higher level of accountability for creating sustainable local healthcare environments. And Whether you do that through pricing or whether you do that through other health management programs, I think all of those, may be important long-term solutions to creating a more sustainable healthcare system. Beyond pricing, if healthcare systems out there really could become those true centers of excellence for the community, whether that's a champion for chronic disease prevention programs, maybe they've created the platforms for better and more affordable primary care access. There's a huge need for more behavioral health investment today, as well as just health equity across the communities that they serve. Healthcare systems, in addition to charity care, should be a primary platform to be able to bring those to market. And if they do so, this is an opportunity to preserve that public trust, make sure they can protect that nonprofit status, taking those dollars and then reinvesting them in their community, and via those actions become, effectively those leading centers for healthcare across the country in a way that, once again, make our healthcare system more affordable and sustainable. So really, there's a huge opportunity now for healthcare systems to have this conversation. Anyone looking at this Indiana law, this would be a major board topic, and use this moment to kind of reimagine what they as healthcare systems can do, once again, to create a more sustainable healthcare system for all of us. So, really appreciate you listening today. Once again, fascinating developments on the policy front, just in terms of the not-for-profit status of healthcare system. We think this could be very impactful. It could lead to new levels of partnerships between employers and providers, and are part of, hopefully, what will be new and innovative solutions coming into the healthcare market in the years ahead. Thank you for watching this episode of A Swift View on Health, and as always, stay cool and stay swift.